Hey folks, Nick the Nurse here. Today we're going to be talking about the nursing interventions associated with a patient who has the nursing problem of coronary artery disease, or CAD. Okay? One of the big nursing interventions that we have to make sure that we put into place when attacking problems in nursing school exams or on the NCLEX is to make sure that we monitor their vital signs. Because remember, we said that one of the risk factors for a patient for developing coronary artery disease is that they might have hypertension. One of the signs and symptoms of coronary artery disease is that they might have, well, they're probably going to have hypertension. So we want to make sure that we constantly and continually monitor those vital signs. Also, we want to make sure that we assist the physician in preparing the patient for any associated types of cardiac surgery or procedures that might come about. These can include PCTA or PTCA, CABG, or an angiogram. Okay, so a lot of these different things are diagnostic and intervention-wise. You want to administer analgesics for pain, particularly if they have angina. Administer anti-anginal medications such as nitroglycerin. I think that kind of goes without saying, but remember, anytime you've got angina, when you should anticipate as a nurse, if your patient does have angina, that the physician will most likely order some type of nitroglycerin or anti-anginal medication. You're probably going to see an order for anti-platelet drugs, because remember, when you have the patient who has coronary artery disease, their coronary arteries are either really stiff or they're really clogged. So we want to make sure that we continue to have perfusion through those vessels and in the rest of the tissues in the body. So we want to make sure that the blood doesn't clot or coagulate too much that it can't pass through or develop a clot or a thrombus. Administer anti-lipid drugs like Lipitor or the statin drugs. Why would you want to do that? Because we want to prevent plaque deposit and formation from cholesterol. We want to make sure that that total cholesterol and that LDL level remains low. We want to monitor lipid levels. We just talked about that. Encourage the patient to consume a low-fat, high-fiber, low-sodium diet. That's very conducive to a healthy heart. Additionally, we want to encourage the patient to adhere to a moderate physical activity program or regimen, and this needs to be cleared by the physician. That's always the caveat you see on those diet commercials you might see on TV that go, before starting any exercise program, please check with your physician. There's a reason for that. We don't want patients dropping dead from overexerting themselves or doing diet plans or exercise regimens that are just too intense for a person based on their own medical history. And that needs to be looked at by a physician or a mid-level provider. Additionally, we want to make sure that the patient stops smoking. Smoking, and I'm not sure if I listed that as a risk factor when we did the video on risk factors and causes, but smoking can certainly put a patient more at risk for developing coronary artery disease, because again, smoking is a vasoconstrictor. The nicotine causes vasoconstriction. We want to make sure that we avoid that so that we can allow for adequate tissue perfusion both in the heart and in the peripheral vasculature. We want to encourage the patient to lose weight. I obviously need to follow some advice there, because obesity, remember, is a risk factor or cause of developing coronary artery disease. Again, the #1 killer of Americans. And we want to monitor EKG readings to see if the patients have any palpitations, PVCs, stuff like that. So a lot to digest. Just go over this, maybe watch the video again if you didn't get all this, the nursing interventions. A lot of good material here. Again, I'm Nick the Nurse. I really appreciate you watching my video today. If you'd like to check out any of my other videos, you can check me out at www.nickthenurse.com. Thank you for watching my video, and we'll see you next time.